Issues at the Lloydminster Hospital have been brought to light over the past few months, showing a lack of staffing for the CT scanner and disruptions to other services. The NDP's Shadow Minister for Rural and Remote Health spoke with Stacey Comer about what they feel needs to be done to help fix the problems.
I have a guest joining me today on Primetime Local News to discuss the ongoing issue that residents in Lloydminster and West Central Saskatchewan have been basically having issues with, and it's to do with the Lloydminster Hospital, the CT scanner, a number of different health-related issues in smaller communities as well. So today I have Meara Conway joining me today from the Saskatchewan NDP, the Rural and Remote Health Shadow Minister. Meara, thanks for taking time to chat with me today.
Very pleased to be here. Thanks for having me, Stacey.
Well, you are well versed, obviously, with what's been happening here. The CT scanner has been, one of the things that most people have been talking about, the fact that it hasn't been staffed 24/7, and there have been a number of people who have come forward and said it has affected them or family members. And in some cases, there are people saying that it may have even resulted in the death or possible deaths of people because they haven't been able to get that care in a timely manner. So, Meara, what have you guys been doing in the NDP to get to the heart of the issue, to what's happening and to how things can be fixed?
Yeah, Stacey, what you say is true. It's very concerning, and the disruptions in the CT scanner at Lloyd have resulted in kind of increasingly crucial situations, including, I think of at least one case in the case of Roger Ogram where it appears like if he had gotten access to care sooner, there may have been a preventable death there. And it's difficult, hearing from her daughter talking about, the way that someone dies matters, And so all those questions, even just the questions the family has around, well, if he'd gotten access to care sooner, would it have been different? And then I think of, the case of Austin Dyer or Kim Nachbar, two Lloydmins, Lloyd residents who've come forward with concerns around a lack of timely access to the CT scanner. Unfortunately, what we've learned, we aren't getting transparency from the SHA or straight answers from the Sask Party government about how often this is happening. We did submit a Freedom of Information request, which we spoke to in a press conference earlier this week, really trying to raise the alarm around this because the disruptions are common. They relate to really crucial healthcare for residents of southwestern Saskatchewan. They impact the entire region, and they are getting worse. So we stood in Regina this week and called on the government to really, get to work on these issues. Most of them relate to short staffing. And what we see from this government is a lack of engagement on that issue. We know that healthcare workers in rural and smaller urban centers in Saskatchewan have been calling for solutions around full-time jobs, around input. We see the nurses asking for a task force. It's a very reasonable ask. We see no movement from the government on these fronts, and we see the issue of staff retention getting worse. We have some of the worst outcomes in terms of rural staff retention in healthcare in Canada.
Well, the Freedom of Information documents that the NDP requested and that have been posted, it's really quite shocking to see not just the Lloydminster Hospital, and it's not just the CT scanner. There's basic radiography services, medical services impacted, and then the smaller communities in this area too. So you talk a little bit about staffing, but this has been going on, in the case of Kim Nachbar Madsen, who I spoke with, her incident was well over a year ago. So things haven't been moving quickly. So what needs to be done? Does the public need to get involved much more? I mean, where do we go with this to help get the changes that we need?
Yeah, I would agree with many of the advocates that you interviewed that it's important for this government to hear from local residents, because what I see happening is this is a government that is taking rural and smaller urban centers for granted because the health services that people need are simply not there, and it's moving in the wrong direction. Like you said, it's ambulatory care, it's ER services, it's lab work, it's radiography, it's obstetrics, and it's not just unique to one community. And of course, when services get thin in one community, they often draw from another. We have the case of Mr. Ogram, where he was racing down the highway to North North Battleford, and we can't say for sure whether the scanner in North Battleford was even going to be there if he had made it. So it's very concerning. And I would say that the lack of transparency and willingness to accept that this is an issue is concerning. I listened with great interest to the interview with Austin Dyer, where he was told this was only an issue in December. Well, we have a Freedom of Information result that shows that this is ongoing. It's becoming more common, more frequent. And so that he's getting information from the SHA and the health minister that, oh, this was just a one-off is deeply concerning.
Well, Meara, I had a chance to show you the statement that I have received from MLA Colleen Young, Lloydminster's MLA, just this morning. I'm just going to go over, paraphrasing a little bit. Colleen Young, the MLA, says, as the MLA for the constituency of Lloydminster, I have and continue to be a strong voice and advocate of healthcare services for my constituents. Over the past 10 years, I've consistently engaged and communicated with the Minister of Health, the ministry staff, and SHA to bring attention to healthcare issues and concerns. She goes on to say, following the campaign in the fall speech from the throne, we announced our goal to work to ensure everyone in Saskatchewan has access to a primary health provider, a doctor or a nurse practitioner by the end of 2028. She says we don't take that promise lightly, and then goes on to say, while the NDP focuses on criticism, we remain dedicated to collaborating with the SHA and stakeholders to find real solutions for improving healthcare access. Meara, what does this statement mean to you when you hear it?
It's disappointing. Here we have an MLA who's been in her post for a decade. She has been the MLA for 10 years. And during her tenure, we have seen the issues in Southwest Saskatchewan only get worse in healthcare, and the situation in Lloyd only get worse. She out of one side of her mouth says that she's committed to solutions, but then out of the other side of her mouth, she touts the Sask Party government's Human Resources Action Plan, which we know has been a total failure. As I said, worst in Canada in terms of retention of healthcare workers in rural communities. Ms. Young's job is to be the champion for her local community in Regina, vis-a-vis her government. It is not to be, the PR person for the Sask Party in her local community and defend a status quo that is not working. So it's disappointing to hear. I think if you speak with stakeholders, they will not say that they're being listened to or heard or collaborated with. Again, this task force that was announced during the election as an 11th hour promise, something that's been asked for by healthcare workers now for years. They said they'd do it. There's been no movement on it. So again, we need to actually collaborate. We need to acknowledge the issue. We need to listen to healthcare workers on the ground because they have ideas around the solutions, and then we need action. We don't need PR statements. We need this MLA to actually show up, take interviews, meet with the people impacted, and then champion those solutions to her government, to her Sask Party colleagues so that things actually get done. And, we have a situation where the health minister is the MLA for North Battleford. This is his backyard. This is his community. Where is he on this issue? Where are all the MLAs that represent these communities? Part of our call this week is, show up for your communities and put your money where your mouth is, because these communities are starting to feel taken for granted.
Well, Meara, it's been a pleasure speaking with you today. Thank you so much for taking the time to join us. And once again, you are asking people to get in contact with their local MLAs and do what they can, get the message out. And I know you guys have been working from your side of things as well. And we will continue to bring the stories of people who are affected by these issues and hope for the best outcome possible. So once again, Meara, thank you so much for speaking with us today.
Thanks for your time today, Stacey, and covering this very important issue. Thank you.
Lloydminster MLA Colleen Young has provided a statement to Primetime Local News regarding the issues with healthcare at the Lloyd Hospital and information released in the NDP press conference this week. She was not available for an interview, but through a statement says she continues to be a strong advocate of healthcare services for her constituents. Young says she has been consistently engaged and communicating with the Minister of Health, ministry staff, and SHA to bring attention to healthcare issues. She adds MLAs are committed to listening to constituents and working with communities to improve service. And while the NDP focus on criticism, The Sask Party remains dedicated to collaborating with the health authority and stakeholders to find real solutions for improving healthcare access.